Hi, my name is Dr. Chris Blevins at Animal Health Clinic in Manchester, Tennessee. The case I have today is from a dog that was hit by a car that suffered a luxated or dislocated hip. Anytime a hip is dislocated, it must be reduced quickly or the likelihood of it staying is very low. Besides doing a total hip replacement, the other option to fix this is a procedure called a Femoral Head Ostectomy, or FHO for short. It is a procedure that is performed for traumatic and chronic conditions that affect the hip joint. The hip is a ball and socket joint. The FHO procedure removes the ball part of the hip. Now let's take a look at a case with a dislocated hip. This is Buddy. He was hit by a car and suffered a fractured pelvis with a dislocated hip. He belonged to a little boy named David who was very concerned about him. As you can see, Buddy's right hip is dislocated, and he also suffered 2 other pelvic fractures and a luxated sacroiliac joint. Luckily, these should heal on their own. As you can see in the x-ray, where the hip is dislocated, there is bone-on-bone contact causing pain. An approach is made to the hip and the femoral head is removed, most commonly with an osteotome or giggly wire. Once the femoral head and neck are removed, the surrounding muscles and developing scar tissue will work together to support the area and act as a false joint. Now let's take a look at some of the video of the surgery. An osteotome and mallet was used to cut the femoral head and neck. At this point in the surgery, I was using an osteotome and mallet to make my cut. Once the cut has been made, I went back with a bone rongeur and smoothed up the edges. You will see this in the next section of video. So a little recap. In many cases, the goal of FHO procedure is to relieve pain associated with hip dysplasia, congenital problems, or traumatic injuries. It is important to note that some dogs may always have some degree of lameness, and this is because of a false joint and slightly shorter leg. This is Buddy's owner, David. He was a very happy boy to get to take Buddy home. David was encouraged to make Buddy exercise in a controlled manner and use the leg to regain some strength. It can take up to 6 months before complete healing and function are evident. I hope you have enjoyed Buddy's story. If you should have any questions about your pet or we could be of any assistance to you, please call 931-728-6633.